Hey everyone, welcome back. So today we're going to be talking about what if Mary Poppins was a therapist? What type of therapy would she practice? Well, if Mary Poppins were a therapist, she would likely practice a unique blend of several therapeutic approaches, all underpinned by her characteristic blend of practicality, insight, and a touch of magic. Here's a speculation. Strengths-based and positive psychology. Mary Poppins consistently focuses on the positive potential within individuals, even when at their lowest. She highlights existing strengths like Jane's imagination or Michael's curiosity, and subtly guides them towards using these strengths to overcome challenges. Her famous spoonful of sugar isn't about ignoring problems, but about approaching them with a more optimistic and proactive mindset. She'd encourage clients to identify their own supercalifragilisticexpialidocious qualities. Experiential and play therapy. A core element of Mary Poppins' approach is her ability to transform mundane tasks and difficult situations into engaging, often fantastical experiences. This aligns perfectly with experiential therapy, where clients learn through doing and experiencing rather than just talking. For children, this would directly translate to play therapy, using imaginative play to explore emotions, practice coping skills, and work through conflicts. For adults, it might involve creative problem-solving exercises or magical reframing of difficult realities. Solution-focused brief therapy. Mary Poppins is highly efficient and goal-oriented. She doesn't dwell on past traumas or lengthy analysis of dysfunction. Instead, she identifies what needs to change and then employs immediate, practical, and often unconventional solutions. Her interventions are brief but impactful, aimed at helping clients move forward quickly. She'd ask what needs to be done and then guide them to achieve it. Family systems therapy with a Poppins twist. So while her primary focus is on children, Mary Poppins clearly understands the systemic issues within the Banks family. She subtly manipulates the family dynamics, influencing Mr. and Mrs. Banks to reevaluate their priorities and connect with their children. Her interventions often ripple throughout the entire family unit, leading to positive change. She wouldn't explicitly diagnose family dysfunction, but her interventions would address it holistically. Cognitive behavioral therapy, subtle and applied. Mary Poppins doesn't use clinical jargon, but her actions often embody CBT principles. She challenges limited beliefs. A Robin's conversation is just as important as a king's. Helps individuals reframe negative thoughts and encourages new behaviors. When she teaches them a tidy mind, she's essentially promoting cognitive restructuring and organizational skills. Existential and meaning-making therapy, unspoken. Underlying her practical approach is a subtle emphasis on finding joy, wonder, and meaning in everyday life. She encourages the Banks and the Banks' children to see the magic in the ordinary, to appreciate beauty, and to connect with each other. This aligns with existential therapies focused on purpose, connection, and embracing the human experience. In essence, Mary Poppins' therapeutic style would be practically perfect, highly effective, efficient, and tailored to the individual's needs. Magical and transformative, incorporating creativity, imagination, and a sense of wonder to facilitate change. Firm but fair, providing clear boundaries and expectations while being inherently kind and compassionate. Empowering, guiding individuals to discover their own inner resources and solutions. Holistic, addressing the individual within their family and broader environment. She would likely eschew traditional diagnostic labels and focus instead on tidying up unhealthy patterns and helping individuals find their own unique, jolly holiday in life. So what do you think? What do you think about Mary Poppins' approach? And would you want her to be your therapist? Let me know in the comments, and I'll speak to you next time.